Let's start with the situation with vaccinations. There's obviously been a massive government push to get it. I guess that continues.
Well, yes, since we learned about Omicron, our strategy has been to buy time to assess it and time to build our defences. And whilst there's still a lot of uncertainty around this new variant, we do know that our very best form of defence is vaccination. Now, sadly, when we look at the latest hospital admissions, a disproportionate number of those people are unvaccinated. And when you look at those requiring the most intensive care, even more are unvaccinated. We know that 2 vaccines aren't quite enough, but having 3 doses is excellent protection. The NHS has done a fantastic job, especially over the last few weeks, working with the military, with volunteers, in offering more and more vaccinations across the country. Over 30 million people boosted, 75% of eligible adults now boosted. That's more than any other country in Europe, but we still need more people to come forward. And we've got 1.5 million slots available over the next few days across England. It's never been so easy to go and get, whether it's your first vaccine shot, your second, or your booster shot. So can I please say to people, please do come forward, get vaccinated, protect yourselves, protect your loved ones, and protect your community.
We'll talk restrictions in a second, but there was this big government push to get pretty much the country vaccinated by the end of the year. Is that no longer possible, do you think? Is that not enough people coming forward to get those people that should be vaccinated?
Well, as a country, when it comes to vaccinations, we've done very well. Over 90% of adults have had at least one vaccine shot. Our focus, because of this new variant, has been on booster shots over the last few weeks. And we said about 3 weeks ago that we want to make sure that every adult in the country has a credible opportunity to get their booster shot by the end of the year. And that commitment will be met. So 75% of eligible adults already boosted, but we want to get that to 100%, and so we want people to come forward. There's plenty of slots, there's plenty of availability, and whilst the NHS is doing a brilliant job, we need people to come forward and protect themselves and their community.
We've been told today that the Prime Minister, I'm sure yourself, have been talking to people, getting the latest figures and the latest data, looking at restrictions in England. What is the latest on that?
Well, of course, we look at the data on a daily basis. That hasn't changed over the Christmas period, but there will be no further measures before the new year. We won't be taking any further measures. Of course, people should remain cautious as we approach New Year celebrations, and take a lateral flow test if that makes sense. Celebrate outside if you can. Have some ventilation indoors if you can. Please remain cautious. And when we get into the new year, of course, we will see then whether we do need to take any further measures, but nothing more until then, at least.
Why take that decision? Because the New Year is a big time, a lot of people mixing, alcohol involved, dangers of passing on a variant like this. We've seen, the restrictions in the other developed nations. Why not in England? Why take that decision?
Well, we look at the data on a daily basis. We get the very best advice from our scientists, our NHS friends, and we put all that together. And whilst, of course, yes, there is still a lot of uncertainty around this variant, it is growing fast. We think some 90% of cases now across England are this new Omicron variant. So it shows you just how quickly it has spread. We have had news in recent days that it's milder. Now, that in itself isn't good news enough. That's good news, but we know that it spreads very rapidly, so we have to set that news against that. But whilst we should all absolutely remain cautious, we don't think there's any need for any further measures until the new year, but of course we will keep that under review.
If people in Scotland, Northern Ireland, Wales, they've had more restrictions, quite stringent restrictions in some places. They're seeing the same data. Why in England is it not happening while it is there?
It's for each country that makes up the United Kingdom to decide how it wants to go forward. So, for example, in England, we decided back in July that we would open up in the summer. I think we look back now, that has been the right decision. We are very, very focused on vaccinations. Our antivirals program has started. As the UK, we now have almost 5 million courses of antivirals. That's more per head than any other country in Europe. We are testing more than any country in Europe, and that helps us to keep us safe. So vaccinations, antivirals, testing regime, and cautious behaviour that we're seeing, people's changing in habits as we've seen over Christmas. This will all help to limit spread, but of course we will watch carefully what is happening in the hospitals. We're working to build hospital capacity as well and continue to do that, but we'll watch the situation very carefully, and should in the future we need to act, of course we won't hesitate to do so.
just on the restrictions that were brought in, wearing masks in certain places. I happened to be working in a football ground, covering a football match yesterday. A huge percentage of people didn't wear masks. More than 40,000 people at a ground didn't wear masks. Almost ignoring the advice, ignoring the rules. Is that a problem? Are people so sick of COVID, so sick of this, so sick of following rules that they are not doing it now? Whatever you say, they're not going to follow those rules.
I think certainly the vast majority of people are following the rules. They're being very sensible. Even their own behaviour, when it's not about rules, but just looking at the very latest guidance about things like ventilation, things like taking a free lateral flow test. If you're especially going to meet someone who's vulnerable, it might be an older relative, you might be visiting a care home, and these are the kind of measures that are really helping and make a difference. But the biggest difference we can all make is to get vaccinated. As I say, there's 1.5 million slots available across England over the next few days. There's never been a better opportunity to get vaccinated, protecting yourself, your family and your loved ones.
Just finally, Royal College of Nursing saying they're concerned because of the rates and the spread and how many people are getting the variant, that staff shortages are a real problem. They're struggling with numbers. How bad is that situation?
Look, staffing is a challenge, and the absenteeism and rates that we're seeing throughout the NHS, particularly in London, are relatively high at the moment. And like in any other sector of the economy in the country, people are having to rightly self-isolate if they become infected. That is having an impact. But some of the recent changes that we've made, especially around the self-isolation rule of moving to 10 days to 7 days, as long as you had negative lateral flow tests in day 6 and day 7, that is really helping at this point. But it's something we're watching very closely and we keep it under review.